So far we have done with the concept of health, well-being, disease, control, right? Now concept of prevention. So control is only after the disease has occurred, you are trying to make some control. So what is the concept of prevention? So it is either primary prevention, secondary prevention or tertiary prevention. So in primary prevention, even before the disease has developed, okay, so even before the agent has entered into the human host, we talk about primary prevention. So in primary prevention, the modes of intervention include health promotion and specific protection. So health promotion and specific protection are the modes of intervention of primary prevention. In secondary prevention, the disease is entered into the body, and what we can at the best do, so we can control the disease. So how are we going to control the disease? We are going to control the disease by diagnosing early and by proper management and by prompt treatment. So early diagnosis and prompt treatment is the intention for secondary prevention. And the disease has entered into the body and you haven't diagnosed, you have missed the case and the person has entered into the late pathogenesis phase. So what you can do, we can at least try to limit the disability. So disability limitation is a kind of intervention for tertiary prevention, or the disability is also occurred. So what the best we can do is we can rehabilitate. So disability limitation and rehabilitation are the interventions of tertiary prevention. So primary prevention, the modes of intervention include health promotion and specific protection. Secondary intervention, the secondary prevention, the mode of intervention include early diagnosis and treatment, and in tertiary prevention it is disability limitation and rehabilitation. So here, even before the concept of primary prevention, we have something called as primordial prevention. So primary is the risk factors are present, but the person has not developed the disease yet, right? Whereas in primordial prevention, you are trying to prevent the evolution of the risk factors itself, okay? So who are the targets in each of the prevention? In primordial prevention, you target the whole population, or at least the high risk group, the selected population who are at high risk of developing the disease. So these are the target group in primordial prevention and primary prevention. Your secondary prevention, you are targeting the people who have the disease. So patients are the targets in secondary and tertiary prevention. Okay, in which phase of the disease you are going to adopt each measure? So primordial prevention, even before the disease has started. Okay, both primordial and primary, even before the disease has started. Primordial is even before the risk factors or the causal factors are present. Secondary is during the early pathogenesis phase, and tertiary is in the late pathogenesis phase. So the mode of intervention, we know health promotion and specific protection in primary prevention. What are the different methods of specific protection? Immunoprophylaxis, giving vaccination is a kind of specific protection. Vaccinating against measles will protect from measles. Okay, chemoprophylaxis, giving rifampicin to contacts of meningococcal meningitis is kind of a specific protection against meningococcal meningitis. IPT, isoniazid preventive therapy for tuberculosis. All HIV patients who are exposed to TB will get isoniazid prevention therapy. So this is a kind of specific protection. So use of specific nutrients or supplementations. Vitamin A supplementation is being given as the National Vitamin A Prophylaxis Program. So the word prophylaxis itself says even before somebody has developed vitamin A deficiency, you are protecting them with vitamin A supplementation, or IFA supplementation, weekly iron folic acid supplementation. So this is a recent program which was given by Government of India, right? So the weekly iron folic acid supplementation which is being given to all adolescent girls and boys. So which is given for school going adolescents and for non-school going adolescents. This is a kind of prevention, primary prevention. You are particularly protecting against iron deficiency anemia. So protection against occupational hazards, wearing personal protective equipments, wearing goggles, thereby you are protecting yourself from occupational cataract, okay, or eye injury because of that. So personal protective equipments in health is a kind of primary prevention, specific protection of primary prevention. Safety of drugs and foods, control of environmental hazards, air pollution is a kind of specific protection. In health promotion, so in health specific protection, we are targeting against a particular disease or a particular condition. In health promotion, it is not targeting against a particular disease or a condition. It is comprehensive. By doing this, you will be able to protect yourself from multiple